Hi, watching the Savera. This is Amarpal Singh before you. As we are observing the World Hypertension Week, to know about this health condition, which is a common health condition but an ignored health condition, hypertension, or also called it high blood pressure, and it is also known as silent killer. So to know about this, to learn what are the symptoms, what are the preventions, and what kind of lifestyle changes we should adopt, we are having with us a noted figure of Ludhiana and a renowned cardiologist, Dr. G.S. Wonder. Welcome, sir, to the Savera.
Thank you. Thank you for the opportunity to spread awareness about hypertension amongst the masses. I really appreciate your efforts.
Dr. Wonder, please brief how serious is this concern regarding the hypertension in India and what are the main causes behind it?
See, India is the most populated country of the world now. Almost 18 to 19% of the world population lives in India. So it is generally felt world over that any common disease, if you can impact in our country, the second most populated country is China, of course, which again is almost similar population as us, you will be impacting the world vagaries of hypertension to the largest extent. So this is the reason that the World Hypertension League is now wanting that Indian doctors, Indian physicians create awareness about hypertension about the masses for one reason that we are the most populated country, and secondly we have the highest prevalence of coronary artery disease or heart attacks in the world. Racially we have a predilection because of our genetic makeup that we succumb to heart attacks more than other races. And high blood pressure is one of the major risk factor for coronary artery disease or heart attack. It not only causes heart attacks, it also causes brain strokes, what is called as adrang in our vernacular language. So to prevent both these diseases, awareness of hypertension amongst the masses is required, and that's the reason that the World Hypertension League expects doctors across the country now to spread awareness about hypertension amongst the masses.
Dr. Wonder, is a younger generation getting more prone to hypertension?
Absolutely. I think that's a very good observation because our lifestyles are getting worse. All this food kitchens that the community kitchens that have come up, people are not cooking food at home. Now, any food that is preserved will have extra salt. We used to make pickles, and for preservation of pickles, we had to put extra salt. Now, all this food which is coming from the community kitchens, which we are ordering through these fast foods, they are all very high in salt. And salt is a major risk factor for high blood pressure. The second important risk factor is obesity. And when people consume such food from community kitchens, their activity levels are going down, obesity is increasing. Today even our Prime Minister couple of weeks back tweeted that obesity is one of the biggest risk factors for many diseases, and hypertension is one of the important diseases.
Right. Dr. Wonder, as we are also witnessing that people, they are becoming health conscious. They are looking after the reels on the Instagram, getting knowledge from the social media also, and implementing such knowledge in their lifestyle also. But where the thing is lacking, what is lacking behind that, the cases are also increasing of hypertension, and people, they are also becoming health conscious.
You have hit the nail on the head. We are becoming health conscious, but we are not doing anything about it. You see, our forefathers used to walk. How many youngsters? I go to the Punjab University every day. I find people of my age. I don't find youngsters. In fact, we often talk with each other. How many youngsters are coming out in the morning and going for a walk? So, lifestyle of this generation, as you rightly said, now they are spending, the screen time is something which has taken away socialization. It has taken away outdoor games. And today, even young children, they have a very high screen time. And that screen time is translating into stress hormones generation in the body. As our activity levels go down, as our diets are becoming worse, the prevalence of high, now you see basic thing, In India, the prevalence of high blood pressure in urban areas is 30%. In rural areas, it is 15%.
Okay.
So all this is the effect of environment on. You can't say that high blood pressure is all genetic. Somebody is destined to have blood pressure. No, there is some risk, but your lifestyle adds to that risk.
Right.
If you are taking stress, if you're not exercising, if your weight has gone up, you're taking too much salt. Alcohol is a very important risk factor for high blood pressure.
Okay.
People, one of my teacher used to say, alcohol is the commonest treatable cause of high blood pressure. If someone stops taking alcohol, the blood pressures will come down.
But it is also seen that in the parties, doctors are also seen taking the alcohol.
So it's easy to preach, no? To practice. That's exactly what we were discussing. The generation knows. So see, this awareness creation, whatever we are telling people is known to them. But as they say, my grandmother used to say, if someone tells a lie 100 times, that also sounds like a truth.
Right.
And we are talking a truth.
Right.
So when we will go to the people, we'll tell them, at least they'll become conscious.
Right.
If we are talking to 100 people, maybe 5, now you are spreading this information. If 100 people listen to it, even if 5 adopt the lifestyle that we are suggesting to them, I think your and our purpose is fulfilled.
Right.
So if you repeatedly tell people that take less salt, don't let your weight go up, see, outdoor exercise is more important. Now you were talking about the younger generation. This exercise which people take in the gyms,
Right.
it's a very surcharged atmosphere. And every day we see people, they are taking synthetic proteins, their kidney functions are getting compromised. And first thing we ask our people, youngsters who come to us is, are you going to the gym? And if they are going to the gym, these artificial proteins that they take, they have actually steroids in them. A lot of them have synthetic steroids also.
Right.
And even synthetic proteins hit on your kidneys. So we have to tell people, this younger generation, that it is not the weight training, it's the outdoor activity. Because how exercise helps you is, it makes your body fit. You can stretch, you can increase your speed, but there is also mind calming effect, which is beneficial for the health. But in a surcharged atmosphere of a gym, that mind calming effect is totally gone.
Right, right. So as we are now witnessing increase in the temperature, the summers are going on over here, and on the same side, on the other end, we are observing the hypertension week. So is this weather condition and hypertension, they are also linked with it? They are interlinked?
Yeah, that's a very good observation you just made. See, as doctors, you talk to 10 doctors, they'll all tell you that I increase my patients' blood pressure medicines in the winter and I reduce their blood pressure medicines in the summer. Because as we sweat, as we move out, especially outdoor people, the blood pressures will be, because sweating takes out salt out of your body. So mostly high blood pressure affects more, heart attacks occur more in winters. Why? Because blood pressures are higher in winters.
Right.
So yes, very good observation. In summer and winter, there is an effect on blood pressure because of the sweating. But someone who is hypertensive, he will need blood pressure medicines even in the summers.
Okay.
Although what we call it as down regulation of therapy in the summer and up regulation of therapy in the winters.
Right. And sir, what are the key symptoms that one should not ignore?
See, firstly, most common thing to realize is that a lot of people will have no symptoms. Because it's a silent disease.
Right.
So don't be complacent if someone doesn't have a symptom, doesn't mean that that person doesn't need to get blood pressure checked. So first thing, no symptoms.
Okay.
But yes, symptoms can be headache, vertigo,
Okay.
Forgetfulness, someone has pain in the chest,
Okay.
someone has urinary discomfort. Those kind of, they are the people who should definitely, but every normal person above 30 years of age should get his or her blood pressure checked once a year at least.
It is also said that if someone having frequent pains in their arms or back, that is also one of kind of symptoms.
Not really actually, but body pains are generally a sign of lack of physical fitness.
Right.
But blood pressure, in fact, what we want to tell people is it's mostly a silent disease. It doesn't cause symptoms. They must go to their nearest GP and get their blood pressure. And another thing is that if your BP is high, Some people at times feel कि जी मेरा तो blood pressure इतना ही है रहता है. That's not a right way to take it.
Right.
If your blood pressure is above 140 by 90,
Right.
you change your lifestyle, reduce salt, go for exercise, stop coke and these cola drinks, reduce coffee, stop alcohol, decrease your fat intake. Get your BP checked after 2 to 3 weeks again.
Right.
If it still remains above 140 by 90, then you are a candidate who will benefit from medicines.
Right. Sir, and what role you see about the regular monitoring of the blood pressure?
Once someone has blood pressure, one should get a blood pressure checked every week or 10 days. Everyday blood pressure checking is not required because blood pressure is a very labile thing. And you don't need to react to one blood pressure reading. If you go to your doctor, invariably doctors are not going to react little bit high, little bit low. They generally want to have an overall idea of 6, 7, 8 readings before they form an idea that whether I want to go up on the medicine or want to go down on the medicine.
Is there any particular age group that requires a frequent monitoring of the BP?
As we age, our blood pressure goes up. People who are more than 60 years of age, the prevalence of high blood pressure is 60%. People who are 30s, 40s, the prevalence is 20-25%. So it's a age related, our arteries become stiff as we age. So it is also an aging phenomenon. So in elderly, you will find high blood pressure is more common than in younger people.
Right. DMC has signed an MOU with district administration. How you are going to work to spread awareness regarding this hypertension or for the healthy lifestyle?
I will really like to appreciate two people in this. One is the district commissioner, Mr. Himanshu Jain, and second is my colleague Bisha Mohan. They have actually created a very innovative way, which I don't think exists anywhere. They have taught blood pressure to school children.
Right.
I think this is an investment for the future because if a young student learns, see, we also often talk of the fact that something that you do yourself, you will never forget. Something that is told to you, you often forget, and something that you are made to see remains in between. So they are making these children check their own blood pressure and their family's blood pressures checked. Because now we have very good quality blood pressure apparatuses. Earlier, the blood pressure had to be checked with a stethoscope. Now these oscillometric devices, which are even the World Hypertension now League advocates the blood pressure by oscillometric method to be used. So these equipments are as good as any equipment in the world. So if someone has, but what we tell people is record blood pressure at home. Do it self. The biggest fear of self monitoring of blood pressure is people start reacting to one reading.
Right.
We tell them we will form an opinion based on 10 readings, not based on one reading. Because if I am at a given time, my blood pressure can be 100 by 70. At another time, it can be 140 by 90. This much fluctuation is normal. So a lay person will start reacting to one. So when we advocate home blood pressure or self recording of blood pressure, we have to teach them one thing besides the correct method of recording is that they should not react to a single reading. We want to have a general idea as to which range the blood pressure is in.
Exactly. Sir, at last, what preventive tips you want to give to the resident that how they can control the hypertension or they can avoid this silent killer?
See, three major factors. Salt is a very big. There is a DASH diet which is advocated, and any food like pickles, papad, Indian food as such. There was an ICMR study which showed that an average Indian consumes 8 to 9 grams of salt, whereas the permissible amount of salt is 4 grams. So we have to reduce the salt that we put in our family cooking by half. Preserved foods. Outdoor foods as less as possible. Alcohol and smoking, absolute no, because they increase the blood pressure. Obesity. People who are obese, they have to bring down their weights. Fat intake. Those who reduce their fat intake, their blood pressures and their heart attack risks significantly reduces. Personality type. People should have learn how to relax, have hobbies, go outdoor, exercise in the out, reduce your screen time as we were discussing sometime. Stress management, self control of your stress, family support, friends, relationships, then exercise. Once someone can use or adapt all these lifestyle measures, your risk of blood pressure will be significantly reduced.
Thank you. Thank you so much. So he is the renowned cardiologist from DMCH, Hero Heart DMC, Dr. G.S. Wonder. So he shared insight about this silent killer hypertension, and he shared the key lifestyle changes that one should adopt to prevent this health condition, hypertension. So we will keep updating you. Stay tuned to the Savera for more updates. Amarpal Singh with cameraman Sandeep Singh.